Hi, everyone. It's Dr. Regato. I'm back to do one more episode for the Pink Ribbon Place. Today, we're going to be talking about changes in physical appearance as the result of cancer treatment. For those of you who've watched the previous episodes I filmed, you know that I'm a licensed clinical psychologist in the state of California. And very specifically, I am a health psychologist, which means that my area of specialty has to do with psychology and where it meets medicine. I primarily work with patients who have different medical conditions, including cancer. One of the things that's really important to remember while you're watching this episode is that even though I'm a licensed clinical psychologist, watching this episode, watching this presentation is not any kind of a treatment. If there's something that you're really struggling with, hopefully this presentation will offer you some helpful information. But the best thing to do if you're having a hard time is always going to be to contact your medical team, talk to your doctor, talk to your nurses, or reach out to a mental health professional. Today, when we talk about the way that the body can change as a result of cancer treatment, we're going to be talking about different kinds of treatment for cancer, the physical changes associated with each, and some things that anybody can do at home to help cope with these changes. So anyone who's been treated for cancer knows that there are a lot of different ways to treat cancer. We have chemotherapy, radiation, more and more people are being treated with immunotherapy. And then for some patients, they undergo stem cell transplants. So chemotherapy basically is an infusion of chemicals that kill fast-growing cells in the body, and this does include cancerous cells. Radiation at high doses can also kill cancer cells and shrink tumors. When immunotherapy is used, basically what happens is that certain parts of the immune system are activated to fight diseases, including cancer. And then the stem cell transplant is a multi-step process, the end of which includes the patient receiving an infusion of healthy stem cells from a donor. Now, there are side effects associated with all of these treatments. And for each of these treatments, one of the possible side effect profiles includes changes in physical appearance. When it comes to chemotherapy, very often patients include changes in their skin. So their skin might feel drier than usual, might be itchier than usual, they might experience some peeling. Some patients report their skin color changing or a change in their pigmentation. When it comes to chemotherapy, sometimes nails are also impacted. So sometimes nail beds darken or the cuticles become really painful. For some patients receiving chemotherapy, they also get really sensitive to the sun. The physical changes associated with radiation are very similar. So again, there's just really dry skin that can be really uncomfortable, itching, peeling, color changes to the skin, and then depending on the site of radiation, and sometimes the dose of the radiation, there could also be swelling at the site the radiation is applied. Same thing with immunotherapy, dry skin. Sometimes with immunotherapy, a patient might also experience a pretty extensive rash or even blistering. And then when it comes to stem cell transplant, remember I mentioned that this is actually a multi-step process. And very often in that process, chemotherapy is introduced to the patient. Sometimes the patient also undergoes radiation. Of course, when you're going through that conditioning regimen to receive a stem cell transplant, if you receive chemotherapy, if you receive radiation, you might experience these skin changes and the nail changes that we already talked about. But one of the things that can happen when you actually have already received the infusion of stem cells is something called graft versus host disease that can cause a rash, it can cause redness. But the primary difference in terms of how it can change the appearance is yellowing of the skin and the eyes, depending on where the graft versus host disease is taking place in the body. Now, those are all of the changes that somebody might expect in terms of their skin and their nails when they are undergoing treatment for cancer. It's also important to note that there are other big changes that can occur as a result of treatment. So scarring is not uncommon. If somebody has to have, let's say, a brain tumor resected, there might be scarring in the scalp. If somebody has to have a mastectomy, there might be scarring at the site of the mastectomy. sometimes if a mastectomy occurs, for example, there could be loss of a whole part of the body. The same thing could happen if there's a limb that's being impacted that is amputated from the patient. Other changes that can occur that are more global include changes of the shape of the face. So certain cancer treatments will include the application or the introduction of a steroid that causes what some patients describe as more jowliness or more swelling along the bottom of the face. Sometimes people refer to this as moon face. That's not a term that everybody likes or appreciates, but it is one that's commonly used. And it's just to describe the way that the shape of the face can change when certain medications are administered. Very often, the entire body shape can change during cancer treatments. So sometimes patients, they lose a lot of weight and they look at themselves in the mirror and they think, I'm so much thinner than I used to be. Where are my curves? Where has my body gone? For other patients, again, depending on the medication that they're taking, they might gain a lot of weight. And sometimes as they're going through cancer treatment, it's really hard for them to lose that weight that can really impact the way that they think about themselves and the way that they feel about themselves. And sometimes even after treatment has ended, it's really hard to get that weight off. So weight loss can really be a struggle and can cause someone to feel like, wow, I don't look at all the way that I did before I started cancer treatment. Now, the big elephant in the room when it comes to physical changes during cancer treatment, of course, has to do with hair loss. And a lot of times, when we think of hair loss associated with cancer treatment, we're thinking about the hair on the head falling out. But the reality is that very often it's not just the hair on the head that falls out. Very often facial hair can fall out, including eyebrows and eyelashes, and hair all over the rest of the body can also fall out, like arm hair and leg hair. It's really important to keep in mind that there are significant individual differences between patients when it comes to how they are impacted by all of these different forms of treatment. There are changes associated with the combination of treatments that are being administered. There are changes associated with dosage, with length of treatment, with relapse, and then maybe having to start treatment again. It's really hard to predict what's going to happen in terms of a changing physical appearance when someone is undergoing cancer treatment. The best thing always, if you're experiencing any of these side effects, is to make sure that you let your physician know. Make sure that you tell your nurse, hey, I'm having a lot of dryness, my skin is starting to peel, my nail beds are getting dark, my cuticles really hurt. It's really important to talk openly about any scarring that can be expected, to be open about hair loss, to be prepared as possible when undergoing treatment. Now, all of these changes can really increase the level of stress, the anxiety, the depression that someone might experience when they're undergoing treatment, and sometimes even after treatment is done. It's really easy to look in the mirror and see somebody and think, who is that person? That is not me. The hair is not mine, or maybe there's no hair at all. I loved my eyelashes, I loved my eyebrows, and now I don't have them. I have this scarring. I'm thinner, I've gained weight. It's really easy to feel lost kind of within yourself and like you're not even that person that you were before you were diagnosed. Of course, there's a lot of stress and a lot of anxiety and a lot of depression that comes along with cancer treatment just in general. If you've watched the previous episodes that I filmed, you know that the statistics are really high when it comes to patients with cancer experiencing a whole range of emotions and a lot of different anxiety. But very often looking in the mirror and feeling like you don't recognize that person, you don't recognize yourself, you don't recognize who you were, can really compound that for a lot of people. It's important to remember that some changes associated with cancer treatment are temporary. For example, more often than not, hair that falls out grows back, scars fade over time. Sometimes it is possible to gain weight or lose weight again after treatment is over, but there are definitely changes that are either permanent or semi-permanent. For example, even if scarring fades over time, it's still there. You still see it in the mirror when you look at yourself. It's possible to have breast reconstruction. And sure, maybe somebody who doesn't know you, who just meets you for the first time, will look at you and not realize that you have breasts that have been reconstructed. But when you get home, when you're changing to go to bed at night, for example, that this is not what your breasts used to look like. For some women who undergo mastectomy, they choose to not have breast reconstruction. And so the whole profile of their body changes. Very often, when this happens, especially to women, there are a lot of conflicting ideas and a lot of conflicting values and feelings that can come up. Women in our society receive a lot of different messages about how they should look, why they should look certain ways, what parts of their bodies are valued, what parts are not valued, what it means to be a woman, how their physical appearance adds to their value or doesn't add to their value. There's a lot of media and a lot of marketing and a lot of messaging that women are subjected to on a regular basis. And so when, in particular, a woman's physical appearance changes drastically because of cancer treatment, it's like all of those messages that she's heard over the course of her life can get really ramped up. And all of a sudden, all of these decisions about, do you wear a wig when your hair falls out? Do you not wear a wig? Do you undergo breast reconstruction? Do you not undergo reconstruction? What do you choose in terms of reconstruction if you do choose to go that way? All of these decisions get very loaded and feel very heavy and very difficult because each one seems to mean something that's more, something that's beyond just, do I wear a wig if my hair falls out or do I not wear a wig? It's really important to recognize that these are very personal individual decisions and that what is right for one woman, for example, is not right for another woman, and that what one patient is comfortable with may not be something that another patient is comfortable with, and that's okay. We all have different values, we all have different ideas, we all have different beliefs about how to approach these kinds of challenges and what certain things mean. And the best thing we can do is just support all of the women in the cancer community with regards to the decisions that they are making for their own bodies and their own physical appearances. Now, I work with a lot of patients who have cancer, and I always encourage my patients to be very well prepared when they go to talk to their physicians and when they go to talk to their nurses about these concerns so that nothing ends up feeling like a surprise. I encourage my patients to take a notebook with them into any appointment where they can write these questions down and to then leave some space where they can write the answers to these questions so that later on, they're not trying to remember what they were told. They're not stressed out. They're not worried about missing a piece of information. It can also really help to have someone sitting in an appointment with you to catch any information that you may have missed. So these are some examples of the questions that I encourage my patients to ask their physicians and to ask their nurses. What kinds of changes should I expect when it comes to my skin and my nails? How likely is it that I'm going to lose my hair? Is there anything preventative that I can do about any of these changes? What changes should I manage at home? And then at what point should I call you about these changes? Are there brands or products that you could recommend? I especially recommend that patients ask that question if they're experiencing a lot of changes to their skin, like a lot of dryness or a lot of peeling, for example, or a lot of redness, to ask their doctors and their nurses what might be helpful when they're at home. Very importantly, I also encourage my patients to ask, what are the brands or products that I should completely avoid? What are the things that I should not be putting on my skin? I always encourage my patients to ask their doctors and their nurses, is there going to be scarring as a result of this procedure? If there is scarring, how will it look? What will it be like? What can I do to minimize scarring? And I also encourage my patients, if they're thinking about reconstruction, to ask, how will my breasts look? How will they feel when I'm done with this process? Some surgeons do keep photographs of the work that they've done. And so if it is an option, and it's not everywhere, but I encourage my patients to ask, do you have photos of your work that I can look at before they make any decisions so that they are really making whatever choices they're going to be making with all of the information they need to feel as if they made a well-informed choice. Now, we're going to talk about some cutting edge, maybe a little bit of controversial research that has to do with preventing hair loss. And I bring this up because very often this is the number one change that a lot of patients with cancer expect when they're going to start treatment. Most people receive a cancer diagnosis, they start treatment, and the expectation is, I am going to lose my hair. There are some things that can potentially help with preventing hair loss. This particular procedure is called scalp hypothermia. Now, back in the day, when this was a newer treatment, this was done by placing ice packs on the patient's head and by using cold caps before, during, and after chemotherapy to help reduce or prevent hair loss. Newer versions of this technology include a two-cap system, where the first cap is basically circulating a cold liquid, and the second cap is keeping the first cap in place to prevent the cold from escaping. The idea here is that the cold really constricts the blood vessels in the scalp, and that constriction reduces the amount of chemo that ends up reaching the cells in the hair follicles. So what the coldness is doing is really making the hair follicle activity less, so it's less attractive to the chemotherapy drugs. Now, the reason I said that this is a little bit controversial and a little bit cutting edge is because the results regarding scalp hypothermia are actually a little bit mixed. When it comes to the older forms, so just using ice packs, for example, the results are not very promising. There's not necessarily good evidence that that really works well. However, the studies using the new cooling caps a little bit more promising. It seems like this might be a little bit more effective when it comes to reducing or preventing hair loss. There are side effects associated with this procedure, just like anything that's done in the world of medicine. So very specifically when it comes to the cooling cap, sometimes patients have complained of headaches. Sometimes there's neck and shoulder stiffness. Obviously, this is something very cold being applied to a sensitive part of the body. So sometimes there's chills and sometimes there's a little bit of pain in the scalp. There are some physicians, there are some scientists and researchers who have raised concerns that these cold caps may potentially reduce how effective the chemotherapy is. Very specifically, there are folks who are saying, if the cooling caps are preventing the chemotherapy from reaching the cells in the hair follicle, that could be problematic if there are cancer cells there, because then the chemotherapy is not getting to them, which means that the cancer is not being treated. And if that's going on, that might mean that the treatment is not going to work as well as it would have without the cooling cap. So there are definitely people who are not supportive or a little bit hesitant of this treatment at this time. At the end of the day, more research is needed, but there are a lot of patients with cancer for whom losing their hair seems really traumatic, a really big deal, and they want to do whatever's possible to avoid that change. So I'm sharing this information just so that you're aware that it's a possibility. At the end of the day, it never hurts to ask your physician or your nurse for their advice about this, what they would recommend. This is not available at every cancer treatment clinic in the country. There are some where it is available. Never hurts to ask, to be a little bit more informed, to hear what your physician has to say, to see if this might be an option. Now, for folks who are maybe resigned to the fact that they're going to be losing their hair, there are lots of different ways to deal with this. Some patients, straight off the bat, they just cut their hair short, or they shave their head. Once that decision is made and that's done, there are some patients who wear wigs. They're very happy wearing the wigs. There are other patients who are miserable and super uncomfortable in the wigs. They find them hot and itchy and just unnatural and kind of anxiety provoking to have to worry if they're going to stay on all of the time. As I mentioned a few slides back, there's no one answer that's right for every single person undergoing cancer treatment. The most important thing is that anybody at risk of losing their hair makes a decision that is the most comfortable for them. When it comes to wearing wigs or hats or scarves, however, if somebody chooses to do that, I usually recommend that they choose an option that has a cotton lining on the inside because it's a little bit less abrasive to the scalp. It's a little bit more comfortable and it's a little bit cooler as well. Now, we've talked about hair loss, and obviously there are a lot of other changes that can go along with cancer treatment when it comes to how the physical appearance might change over time. One of the things that I really encourage my patients to do if they are struggling with this is to make sure that no matter what it looks like, they have some sort of a routine around hygiene and grooming. It can be very grounding to us as human beings, as individuals, to take care of our bodies. The mind and the body are connected, and taking care of the body really well goes a long way to taking care of the mind. So, whether someone is at home, whether they're going to a clinic visit, whether they are admitted to the hospital, I encourage patients every day get up, change out of your pajamas into clothes that's comfortable, but not for laying in bed. If you can, if you can't, that's okay. Every day, try to wash your face, brush your teeth. Everyone feels better after brushing their teeth. Every day, if you can, use lotions, use creams as recommended or permitted by your medical team. If you can, indulge in some self-care. So if your doctor thinks it's okay for you to soak in a tub, maybe with Epsom salt or whatever is soothing or relaxing to you, do that. If your doctor and your nurses are okay with you painting your nails, do that. I wouldn't recommend going to a nail salon because there are some concerns about infections, maybe if you're immunocompromised. But painting your nails at home and having well done nails makes some people feel really good. So think about the things that are important to you. Think about the things that help you feel good and do those things on a regular basis, whether it's a good day or a bad day, because most patients, if they take care of themselves regularly when it comes to hygiene and grooming, it makes them feel better and it helps them cope and accommodate with the changes going on in their body as they go through treatment. Now, the other thing that I usually discuss with my patients when it comes to the physical changes associated with cancer treatment is how much our physical appearance impacts the way that we think of ourselves. Whether we think of ourselves as beautiful or not, whether we think of ourselves as thin, as heavy, as curvy, as non-curvy, as light-skinned, as dark-skinned, very often our identity is in some ways attached to how we see ourselves physically in the mirror, how we perceive ourselves in photographs. And these are some of the things that contribute to our self-esteem, our sense of confidence, our sense of ability in who we are in the world. It's not a good thing or a bad thing. It's not right or wrong. It's just the way humans are socialized, whether they're men or women, or non-binary in this country. And very often the messages towards women are that your physical appearance is a huge part of your identity development. So when the physical appearance changes, especially if it changes drastically, it can make someone feel like they're not even themselves anymore. And if that starts to happen, what I encourage is that that individual focus on other parts of their identity. Who are they within the context of their relationships? Who are they as parents? Who are they as children? Who are they as friends, as employees, as members of some sort of a religious community? I encourage patients to engage in hobbies and different activities. Our identity is very often tied up in the things that we love to do and the things that we're passionate about, whether it's reading or painting or cooking. When we're struggling to know who we are, when we're struggling to remember who we've been, engaging in a hobby that we love can be really grounding. I also encourage my patients to review past achievements and to really focus on memories of the time before they were diagnosed with cancer, whether they were, very athletic and competitive, whether they were the best employee at their company, whether they baked the best chocolate chip cookies for their kids, whatever they did really well. I encourage patients to remember that and to hold on to that because those are the parts of identity that really can allow us to feel good about ourselves. And those parts of who we are don't change and don't get taken away just because our physical appearance is changing. So I encourage my patients, when you look in the mirror and you don't feel like you know who you are anymore, think back to all of your relationships, the things that you love doing, the things that you do well, and remember that those are part of you, even if you don't look the same in the mirror anymore. I also encourage my patients to try to make meaning out of these changes. Sometimes religious beliefs can help with this. Sometimes spiritual beliefs can help with this. Being part of different communities where people gather to make meaning of difficult things in life. That could be in a cultural setting, that can be in a religious or a spiritual setting. That can be really helpful because making meaning of the difficult things that happen to us informs who we are as those difficult things unfold and once those difficult things have ended. So I encourage patients to figure out a way to make sense, to understand what it is that they're going through, so that the focus is on who they are becoming, how they are transforming, and who they're going to be, instead of saying, I'm not who I was anymore. That is something that's really important to grieve for a lot of individuals, and also to have forward momentum and say, I don't look like myself, but there are parts of me that are still the same. I am still the same person. Now, who do I get to be on the other end of treatment for cancer? There are a lot of great resources out there for anybody who might be struggling with this. The American Cancer Society has a really great website with a lot of great recommendations. The Pink Ribbon Place, of course, has a lot of good resources that are available. And there are also other people out there who can help. I always encourage people, if you've been given a diagnosis of cancer, go find a therapist. This is a hard journey. This is a struggle. This is a challenge. Of course, you have your family and your friends and your religious community and your work community and your academic community, maybe. But find a trained professional that you can talk to if you start to struggle with anything that we've discussed in this episode. Best way to find a therapist is to go to your insurance provider, because that way you know that services are covered and you're just going to be charged a copay. There are lots of other websites where you might be able to find someone. The American Psychological Association has a great website where you can find a provider. Psychology Today is actually one of the most popular websites to find a provider. And then if you want someone that you know for sure has been trained in health psychology, you can look at the website for the National Register of Health Service Psychologists. Whenever you're looking for a therapist, remember, you want someone who's going to be a good fit for you, that you can get along with, that you can trust, but you also want to make sure that they have the training to support you. So you want to make sure that you're seeing somebody who has experience working with patients who have cancer, so that they actually know how to support you and guide you through this journey. In summary, as you're going through treatment for cancer, changes in physical appearance are completely normal. They're to be expected. And even though they're normal and to be expected, they can still be really upsetting. There are ways to manage these changes at home and also from a medical perspective. We just need to be honest about what's going on, honest about concerns, direct in our conversation so we know what to expect. And once we're at a place where these changes are happening, there are absolutely resources that can help. I hope that this presentation has been helpful. I hope that you've gleaned some valuable information and some resources. And remember that if this is something that you're struggling